Good afternoon. Welcome to the Federation for Special Needs. Just checking. Okay. Wellness Wednesday. I'm your host for today. My name is Jennifer Balzanelli. I work as an information specialist with Mass Family Voices. I hope that you are all staying home and staying healthy. I have 4 kids of my own here at home, and I'm working hard on balancing their education, working, and parenting. I also have parents who live out of state that have health issues and have some very real fears about COVID-19. And thinking about keeping healthy, we should also be preparing ourselves in the case of an emergency. What can we do to be best prepared in case of an emergency in these unprecedented times? We can start by having a conversation about COVID-19 with your child or young adult. Let them know what they might experience, how it is spreading, and the best way to stop the spread. Boston Children's Hospital has many resources listed to aid in discussing COVID-19 with your child. Here's an example of their this is called Explaining COVID-19 to 6 to 12-year-olds. They have different versions for other ages as well. I will post a link to this in the comments after we're done. UMass Shriver Center has also developed an emergency readiness toolkit for parents of children with disabilities or special healthcare needs. This is the cover of the document for your reference. I'll also post that link. Communicating with your child or young adult's pediatrician or primary care physician is important. Ask them to make a notation in the chart that your child may require assistance with healthcare decisions or answering questions about their health history. If you already have guardianship, the office should already have this information. While having this notated in the chart will not necessarily grant you access with your child during an emergency, it may help. You should also call your hospital of choice or the hospital that your youth would be taken to in case of an emergency to ask what their current policy is with regard to accompanying them during an emergency. It will be much easier to ask in advance than to try and answer situations. Different prior to this pandemic. This is an extremely stressful situation that is compounded by the fact that you would potentially be denied access to assist your youth with their healthcare needs. Remember to stay calm. Hospitals and healthcare workers are new to this as well and are doing the best they can to keep everyone safe and healthy. So what can we do to be prepared? Here are some things you can do to be better prepared. Have your insurance cards ready and available. Create a list of medications and times they are given. Create a 1-page healthcare summary. Make copies and have ready any documents such as guardianship papers, power of attorney documents, healthcare proxy, and a current 485, which is a home healthcare agency's plan of care and certification or recertification in case the physician needs to assume oversight of a patient care. Make a list of items you will need to grab at the last minute. This could include your cell phone and charger, any medical equipment such as tubing supplies, apnea machines, etc., medications, items to entertain while you're waiting, iPad charger, an iPad, books on tape, an actual book, music, headphones. Pack a grab-and-go bag to have ready with items that you don't need every day, such as a change of clothes, toiletry items, other personal healthcare items that you might need. I also wanted to show you this emergency plan document that you can fill out and have handy. I will include this link as well when we are finished. This form goes over some additional items that you may not have thought of. For example, who will look after any pets you need if you need to stay at the hospital with your loved one? Who has a spare key in case someone needs to get into your house? Or who can you share this plan with? The website complexchild.org has a detailed list of how to be prepared for hospitalization of a child who is medically complex during the COVID-19 pandemic. This list includes such items as what is your child's code status, listing their critical risks, such as behavioral risks or fall risks, nutritional information, how and when they are fed, critical information pertinent to the care. For example, if they have atypical vital signs, if the child is nonverbal. This article also discussed the fact that if you are let in with your child, there will likely be restrictions and precautions that you will need to follow. You may be required to be screened daily for COVID if your child is admitted with the virus. You will have restrictions on your movement around the facility. You may or may not be able to leave at night. You will be asked to wear personal protective equipment. It's important to note that you should contact the physician you or your child deal with most if you are experiencing any illnesses or ailments that you think you may need to be checked by a doctor. Due to social distancing and stay-at-home orders, there may be other options available to you instead of going to the ER. Many physicians are offering telemedicine. This could allow you to make modifications at home with your existing equipment or medications. Another important note is, although this is more focused on what happens when your child becomes sick, you should also be prepared for the possibility that you could become ill and not be able to care for your child. Make the appropriate preparations for this scenario as well. I'm also going to be posting a link to our new Mass Family Voices Facebook group, which is under the Federation's Facebook page. Previously, we had used Yahoo Listserv and will be sending out an email this week about this new private group on Facebook. Thank you for joining us today. Look for our resource links in the comments and join us tomorrow. Have a great day. Stay healthy.